Miles, I want to welcome you to the Plugged In podcast. Today we have Miles Beckett. Miles is the CEO and founder at Flossy. Miles, it's great to have you. How are you?
I'm great. Thank you. Thanks for having me, Mark.
Crazy, we're in February. It's we're halfway through. How's 2025 kind of kicked off for you? Is it been an interesting one?
For us, it's been interesting. I actually live in Mandeville Canyon in LA, so we were right next to the line of the fire. So the very beginning of the year for me was getting evacuated from our home, bouncing around. Now we're very lucky. Our house is okay. Our little area is fine, but we have a lot of friends who lost houses. So it's been kind of crazy, but we're starting to try to get back to normal.
Yeah, that's tough. And what's the kind of general vibe around the neighborhood where you are? Do you find that things like this bring people together? Is that what you've seen?
Yeah, for sure. It's been really nice in that regard. It's absolutely brought people together. Our school, a lot of people lost their homes, and there's been some really good camaraderie and people helping each other out and trying to help people find housing and navigate insurance companies and all that. So I would say, if there is any silver lining, it's that the community is definitely very strong and people have come together.
That's amazing. I mean, the whole premise of business, as you know, Miles, is to solve a problem, and it's great when communities can come together and tackle challenges in the right way. And it's really good to hear. I would love to know because Flossie is interesting. When I hear Flossie, it reminds me of my grandmother actually. So obviously, when you hear a name like Flossie, I always like to know what is the meaning behind that? Like, what is Flossy and what problem does Flossy solve? I'm always fascinated by the name. Where did that come from?
Yeah, sure. So when we started the company, obviously we're in the dental space. So we were playing around with words that were somewhat dental related, and then some that were totally unrelated. And we just kept coming back to the name Flossy. Picking a name for a business is really hard because you need something that sounds good and makes sense for your product or service or company or the area that you're in. You also need to be able to get the domain name, preferably the .com, and it needs to be trademarkable. So there's like a lot of considerations every time you try to do it. But yeah, we really like the way the name sounded. And Flossy is obviously a play on the word floss. It also means like fly or cool. And then there's also the dance, the floss. And we just thought it sounded and had a connotation of just kind of like being cool or hip or whatever, forward thinking. It's pretty memorable when we kind of did tests with friends. They seem to recall the name well. And the URL was available. We could trademark it. So it all came together.
It's interesting when you mentioned dance because that's exactly why it reminds me of my grandmother because she used to do lots of burlesque dancing and floss was something that I remember having conversations about. So, but yeah, I
Right.
love when the name of a brand or a business actually opens a window into the essence of what it's about because I always think of like words like Google, unless you're kind of really creating something with a new identity, you have to be so careful, don't you, with names. So if you're going to pick a name that already has an identity, it really needs to express what it's really getting at.
Yeah, 100%. And it's got to be memorable. I mean, I think that's the most important thing too. We had this issue actually with my first company. We changed names like so many times. We also were changing what we were doing in the beginning. So we were like, a production company, and then we were like a digital studio, and then we were an influencer business. And I don't think that company was called Equal, but it was spelled without a U, which always threw people off and they always pronounced it wrong. And yeah, so anyway, I've tried to be a bit better. My last business was called Silver Sheet. And that also, like, people liked a lot. It resonated. It sounded somewhat familiar, but was novel. So I've tried a bit harder to try to come up with good names. I think Flossy's the best so far. I mean, having a short one like that is also nice.
Yeah, I agree. It's very catchy and has a lot behind it. What inspired you then, Miles, to shift from like plastic surgery to developing AI led startups in healthcare? What made you transition?
Yeah, so I was a plastic surgery resident, and I left the program in 2005. I got my license and I worked as a doctor in urgent care for about a year and a half. But that was like my side gig to make some money while I was trying to get involved in this whole Web 2.0 thing, which was kind of emerging. And I got super into YouTube in the early days. And so it's been a bit of a circuitous journey. I mean, I was very, very into YouTube, making videos on YouTube. We ended up having the number one channel from '06 to '08. That became, as I was saying, a digital studio and then ultimately an influencer company. And then when I sold that company in 2012, I really wanted to double down on more of the tech side of things, that some of the stuff we've been doing there. And we built a SaaS business called Silversheet, which I sold. And then I just got super interested in dental. It felt like there was a lot of opportunity. There's a lot of opportunity in healthcare broadly. It's still pretty behind other industries in terms of tech adoption. And then over the last year or so, with the emergence of generative AI, we just got very excited about that. And I would say it feels like a new wave of technology, akin to the emergence of the internet in the late '90s.
Hmm. And I noticed that you created a an AI assistant called Fiona, and I'll probably ask you why the name Fiona. I don't know whether it's got any links with Shrek or what, but you created
Yeah.
Fiona in 45 days, which is incredible. And with that being said, what does that really say about the speed of innovation in AI?
Yeah, no, I think that's a really good question. Yeah, so Fiona, we just like the name. We didn't intentionally name her Fiona because of Shrek, although we do have an internal AI that's like a patient that can interact with Fiona. So it's two AIs talking together to make Fiona better. And we call that other AI Shrek, which just kind of for fun. The engineers named that one. But yeah, so we built the product in 45 days, and that's not like a prototype. That was truly idea. We built the prototype for Fiona to just test it out in like 48 hours. We then built the actual production grade product in 45 days. And all of our engineers use Cursor as part of the development process. So that's like an AI tool that will generate code. Um, and that's really helpful for getting things built quickly. We also, had prior experience. We've been in dental for a while. We had been doing stuff with AI before, so we had a large data set that we could work from. So that helped for sure. But I definitely think that the cost of software development and the time that it takes to develop production grade software is dramatically decreasing, like as we speak. And I think we're going to see a huge amount of both disruption and opportunity that comes out of that over the next 6 to 12 months and beyond.
I think one of the challenges of AI and one of the resistance points from discussions I've had and what I see, and when some people run as far away from it while others embrace it and kind of see it as their best friend. I think one of the challenges really is around keeping it human. So, how does Fiona assist you, but also keep healthcare human and personal while also being more efficient? Because the whole point of AI really, I think, is around efficiency.
Yeah, for sure. Yeah, I mean, she's definitely an augmentation tool for the human staff. She's scary good. Like, so we had looked into some of this voice technology um, about like a year and a half ago. We were running a call center at the time, and it really wasn't very good. It was not anything that you could bring to production that a patient would want to interact with. But starting last summer, some of the newer models, things from like 11 Labs and some of the others were pretty good. And it seemed like you could build something that was really functional. And then, every time there's an update to one of the models, our product just gets better. Um, but so the way we think about it is, when you talk to Fiona, it is like talking to a human. She sounds perfect. There's a tiny bit of latency in her response, which I think is the biggest thing that everybody's working on. That's going to get solved over the next 3 to 6 months. And then it's going to be pretty much like talking to a person. She can handle a whole variety of tasks. So she can book an appointment, she can reschedule an appointment for existing patients, new patients. She can kind of triage them and decide if it's an emergency. So there's a lot, but she can't do everything. And so the way that we think about it is like if you're somebody that works in a dental practice at the front desk, you're doing a bunch of different things. You're answering phone calls, you're handling patients that are there that are coming in that need to be to go through intake. You're saying goodbye to patients, you're scheduling them for follow-ups. You're probably doing other things. Oftentimes, front desk people might even have a clinical background. They might be a medical tech, a dental tech, or like a hygienist or something that's just doing double duty. And so we think of this technology as really allowing them to focus more on both patient care and sort of that in-office patient experience, such that the phone operations can be at least partially, and I think pretty rapidly, entirely handled by an AI agent.
Okay, and do you feel like is there anything that you feel like AI should stay away from, and for it to stay human, where it's not being automated, where you feel like actually AI shouldn't touch this?
Yeah, I mean, I think that like empathy and human connection and creativity and extremely high level strategy and like task organization is going to be a long time. I'm not going to say forever. I will never say anything is forever in technology. Like ultimately, it's probably all AI, but I think it's a very long time. And maybe forever. I mean, I think that at least even if an AI could be perfectly empathetic, I do think that simply knowing that it is not human has an effect on the human experience on the other end. And so, especially in healthcare, really the core job of a clinician is empathy. It's being there with that person, with their family. It's caring for them. And so I don't think that that ever goes away. And the analogy that I use is, is AI in healthcare going to be an elevator experience or an airplane experience? And when I say that, elevators go up and down totally on their own. Back in the day, there were elevator operators. They were not automated. But when automation came about, that job went away. And it is just a box that you get into. Airplanes can fly themselves, can land themselves, can take off completely on their own. In fact, usually most aircraft accidents that happen now are due to humans intervening and taking over for the machine when they should not. But we still have pilots that fly airplanes. And the reason we do that is because I don't know if they'll ever be comfortable with a plane just autonomously flying. And so I would say the bar is even higher in healthcare, where not only is there that comfort level experience, but it's also you want a human there to care about you and to care about your family members.
Yeah, I think you've answered that really, really well because I think that when it comes to your body, and obviously our world is all about preserving life, isn't it? So when it comes to healthcare, it's probably the most important and the most personal. So the whole process needs to be efficient. We need more efficiency. In the UK, our health service is completely broken for the fact that it doesn't have the ability to be able to pool treatments together where you go to one department and then you end up going back to the department that's right next to it 3 months later and they don't even talk to each other. And you're just like, there's no efficiency there, and
Yeah.
obviously AI in terms of being able to automate some of that and make sure that everything is speaking and has an order will be of benefit to the patient, but also obviously the medical professionals, right?
I agree. And I mean, that challenge that you're describing in the NHS is like we have the same challenge in the US, right? Like coordination of care is the issue, right? The number three cause of death in the United States is medical error, which is shocking.
Mm.
And when I was in med school, this drove me crazy. There's many reasons why I stopped being a doctor, but this was one of them. And ironically, the VA system in the US is actually quite good for veterans. Part of the reason why it's really good, their outcomes are great, is because they have a single digital system that powers the entire veterans hospital system across the entire United States for everything, for doctors writing notes, for prescribing, for records, for scheduling. It's this whole massive system. And because of that, even if a vet is seeing somebody in Detroit and then they come to LA, all their records are available down to the minutia, the labs, the x-rays, every single fragment of it. And that's hard to do in a distributed system or a private system. Now, and I think there's benefits to the private system as well, but I think that it's gotten better as technology has improved, but stitching all that technology together is still hard using APIs. Not everybody has them. It's hard to build that technology. And I think AI offers the opportunity to improve that. I mean, one of the use cases we've thought about for Fiona is just calling insurance companies to be able to get an answer as to the verification of a patient's insurance or to get updates on payments. And we think of that as almost like a real world API, right? Like that company doesn't have the technology to get me the data. I'm going to have a computer call it a human there to extract it. And maybe over time they'll get annoyed from those calls and they'll actually build an API.
Mm, amazing. We've only got a few minutes left, Miles. I want you to let us know how do we find out more about Flossy and the work that you do, and just take a couple of moments just to touch on anything that you feel like you really want to emphasize or really get across, maybe for us to really consider or ponder.
Sure, yeah. So they can go to flossy.com, Flossy.com, or they can follow me on X, M Beckett on X. And in terms of something to ponder, yeah, I mean, I guess I would say don't be scared about AI. When I first was getting into this, even as a tech geek, I was worried about it. And I think I was buying into a lot of these doom and gloom scenarios around it's going to like take over the world and be like Terminator or whatever. Um, and where I'm at kind of now is it's an extremely powerful technology. And at its core, generative AI, really, it's a very sophisticated statistical engine that can guess the next item in a sequence, whether it's a sequence of words or letters or numbers or states or countries or any sequence of tokens. It's really good at guessing what the next one is. And on the one hand, that's really simple. It doesn't really do that much. On the other hand, when you think about it deeper, it's very powerful, but it's not Terminator. It's not actually intelligent, but it is extremely powerful and it can be used to do pretty incredible things. So I would say embrace AI and don't be afraid of it.
Yeah, I think people are realizing that it isn't going anywhere, and you either work with it for your advantage, or you run the risk of it, yeah, taking over whether you
Oh,
like
yeah.
it or not.
You can't fight technology. Like
No.
technology moves forward no matter what. Any attempts to stop it always look foolish in hindsight. And all we can do is try to manage it and embrace it and work with it in a way that will push it in a better direction, right?
Mm. Miles, thank you for joining me on the Plugged In podcast. I really appreciate it, and look forward to seeing your continual growth. All the best.
Awesome. Thanks a lot, Mark. Thanks for having me.
Cheers.